The second experiment that we will discuss is the erythrocyte sedimentation rate, or the ESR. Now, if you take a sample of blood and put it in a tube in a vertical position and leave it for a while, you will notice that the red blood cells, they will sediment at the bottom of the tube. And they will separate from the plasma and they will precipitate or sediment at the bottom of the tube. And this is because the density of red blood cells is higher than the density of the plasma. So this is the basics for this test, the ESR. The ESR, by definition, is the rate at which red blood cells settle out or sediment when anticoagulated whole blood is allowed to stand for a period of 1 hour. And it's very important to know that the ESR measures the rate of RBC sedimentation in 1 hour. This test is very simple, it's very sensitive, but it's non-specific. It is used as a screening test to assess for the presence of inflammation in a certain patient. Okay, so it is simple and sensitive. And in cases of inflammation, you will notice that the ESR is going to increase, that the sedimentation of RBCs is going to increase, but it's non-specific because it does not tell you what type of inflammation is found in this patient. It only reflects the presence of inflammation. So in cases of inflammation, you will notice that the ESR increases. Okay, so any inflammatory condition will increase the sedimentation of RBCs. Okay, so RBCs sediment because their density is greater than that of the plasma. And the sedimentation will increase if RBCs are stacked on top of each other. Okay, the stacking of RBCs leads to something called relay formation. Okay, and this happens because RBCs have discoid shape, and this enables them to stack on top of each other like this. Now, normally, in normal conditions, and because RBCs have negative charges on the outside of the cell due to the presence of the different types of proteins, RBCs repel each other and they don't stack like this on top of each other. Okay, but when inflammation is present, and you know that inflammatory conditions are associated with an increase in plasma proteins, different types of plasma proteins, and most of these proteins have positive charges. This will sort of neutralize the negative charges of RBCs, and it will allow the RBCs to stack on top of each other like this and form the relay formations. Now, when RBCs are stacked like this, their sedimentation will be faster, okay, because now they will be heavier and they will sediment faster. So this is what happens. Normally RBCs, they sediment and they will settle at the bottom of the tube when left for 1 hour. But in the presence of inflammation and because of the stacking of RBCs, the rate of sedimentation is gonna increase. So the ESR will be higher with inflammatory conditions. Okay, so to do the test, you only need a blood sample and an ESR tube. And it's important to notice that the ESR tubes are different than other tubes in that the 0 mark is at the top of the tube, not at the bottom. So what we do here is that we will take anticoagulated blood, we will draw it into the ESR tube up to the 0 mark, and then we will place the tube in a vertical position for 1 hour. Of course, after 1 hour, we will take the tube and we will take the reading. Okay, we will see how much the RBCs have settled. I will show you a picture now. Okay, so this is at the beginning of the experiment. We put the blood into the tube up to the 0 mark, and then we leave it for 1 hour. After 1 hour, you will see that there is a part of the blood, this part, it became clear of RBCs because the RBCs have settled down. This is plasma only. Okay, so we will take the measurement. يعني هون as you can see إنه RBCs have settled down by 18 millimeter per hour. So within this hour, the RBCs have settled by 18 millimeter. يعني في عنا هون منطقة طولها 18 مليمتر صارت free of RBCs. It's only plasma. So the ESR in this case is 18 millimeter per hour. Okay. دائما احنا ال ESR بناخده as a rate millimeter per hour. And it's important to take the reading 1 hour after we put the sample, exactly 1 hour. We cannot take it after half an hour and multiply by 2, or after 2 hours and divide it by 2. No, you have to take it exactly 1 hour after you put the sample. Now, what are the normal ESR values? In adult males, it should be less than 15 millimeter per hour. In adult females, it should be less than 20 millimeters per hour. So if we have a patient that has high ESR, most probably this patient has inflammation. What type of inflammation, we cannot know, but we will know that he has inflammation. Now, there are other conditions that might lead to a high ESR value, although the patient does not have inflammation, like anemia. A patient who has anemia will have high ESR. Elderly people will have high ESR. In pregnancy, in pregnant females, we will have a high ESR. Sometimes there are some technical errors that might increase the value of the ESR. Like if when we put the ESR tube in the rack, it is tilted. Tilting the ESR tube will increase the sedimentation of RBCs or a high room temperature. Now, there are some conditions that might abnormally decrease the ESR. Okay, so that the ESR will be lower than expected. One of these is having abnormally shaped red blood cells. Yani people who have sickle cell disease or people who have spherocytosis, these people will have abnormally low ESR because these abnormally shaped RBCs cannot stack on top of each other. So even in the presence of inflammation, they cannot stack. لأنه حكينا الstacking depends on the discoid shape of RBCs. So the RBCs cannot stack on top of each other, and the sedimentation does not increase as it should in cases of inflammation. The other condition is polycythemia because of the high number of RBCs, which will repel each other and they will not sediment easily. The blood sample will have high viscosity as well, which will decrease the sedimentation. There are also technical errors that might decrease it, such as low room temperature, a delay in test performance. Yani if you draw a sample from a patient and does not perform the ESR immediately, this might cause a reduction in ESR. عادة نحن بنحكي إنه ESR should be done within 2 hours after taking the blood sample from the patient. Or if the blood sample, of course, is clotted, if it's not properly coagulated, anticoagulated, it will clot, and this will decrease the ESR.